Thank you and good afternoon. Welcome to our February 14th work session. I want to welcome you all here. Happy Valentine's Day to everyone. And our Division of Information and Services, I always call them IT, is starting to get more like a film production team. I want to thank them for evolving with us and for everything that you do. And all of our visitors, we want to welcome you here, and administrators that we may have. Thank you for coming. We're going to move right into, you want to introduce you go ahead and turn your mic on.
Thank you, Madam Chair. As you know, the last couple of years, we have all been enduring quite a bit of back and forth in terms of the pandemic and the implications it's had for teaching and learning, as well as just overall health in our community and specifically in our schools. And to that end, I've been very fortunate. Early on, I was able to provide medical experience and experts in our community who have helped to inform our decisions along the way, respectively, whether it be masking or vaccinations, whatever it might be. And we've been very fortunate to have people in our field, in their respective field, who are in fact recognized experts, not just within our community, but across the state and nation. And joining us this evening, we do have Dr. Ramey, who is with Rivertown Pediatrics, and she's been here. Is that correct? I'm sorry, Piedmont, excuse me, I apologize for that, Piedmont. But she's one of the many doctors we've had on our panel. And as we announced back prior to the holidays, you recall we had talked about moving to mask optional at that point. And then, of course, we all experienced the Omicron variant that created more havoc in our community. But since that time, we had planned to move after MLK Day with moving to mask optional at that point. However, we've been meeting with our medical panel, and that was delayed. But as you know, today is our first day of mask optional in our school district going forward. And I'd just like to introduce and thank Dr. Ramey for, on behalf of all of our medical panel, who are, by the way, in case anyone doesn't know by this point, our medical panel is comprised of pediatricians, workmen's compensation doctors, Department of Public Health, epidemiologists, and a variety of different experts in their respective field. And Dr. Ramey, I don't know if you'd like to just share with our board here just a little bit about how we arrived at the decision so we can help ease people's concerns that it was not something we just arbitrarily decided to do on our part, but based on our local conditions. And one of the things I do want to make sure everybody understands, from the very inception of the medical panel, they took all of the data, the science, and the guidance that was provided at the national level and filtered that through and vetted it at the local level. So we are not responding to anything that's just a blanket statement by the CDC. They take that under advisement. We look at what's in the best interest of our school, our community, and then look at our local conditions, because we feel like that's critically important to vet everything through the lens of our local community. So that said, I just want to thank Dr. Ramey and all of her counterparts who worked with us in helping us to inform our decisions over the last 2 years and have been so giving of their time on a regular basis to meet with us, look at the data, look at the guidance that's provided at the national and state level, and then inform our decisions. So I just cannot tell you from a personal standpoint how much I appreciate it, and professionally I have so much respect and admiration for all that you've done. So with that said, thank you for being here this evening.
Thank you so much, Dr. Lewis. Yeah, it's been a tough 2 years, and we appreciate you guys kind of rolling with the punches. We know we've had to adjust, you know, every couple of weeks. It seems like things are different. Certainly before the holidays, we were hopeful that we'd be able to go back to mask optional, but the Omicron variant really hit us really, really hard in January. And I'm at Piedmont, so I have, you know, information from all 14 of the Piedmont hospitals around the state. So we were able to watch kind of what the numbers were doing, and we're finally heading in the right direction. In addition, now that vaccines are available for everybody over the age of 5, we feel like it's a good time, and it hopefully will encourage people to get caught up in their vaccines. Unfortunately, Muscogee County is still only at 43% vaccination, which is terrible. Honestly, it's terrible. The only people who are really highly vaccinated are those over the age of 65. So, of course, that leaves our children out. So that's really one of the most important things that we can do at this point is to make sure that everyone gets vaccinated, because it's the only way that this is going to go away. And it has been all that we have been able to think about for 2 years.
And again, I recognize that I'm not an expert in this. If it's about educational matters, I'm certainly comfortable with making those decisions. But that's, again, a reason why we put this panel together that's 23, 24 months ago, whatever it's been now, to really look at that data again and to look at where our cases are. And they've been falling off precipitously over the last 3 or 4 weeks. In talking with the epidemiologists, they're telling us that they don't foresee anything for the next 3 months. I don't want to put words in your mouth, but that's what we talked about and looked about going forward. Another reason we're able to make this. One of the things I really wanted to do, too, is make sure we weren't doing what some people had done, is taking the mask off, putting it back on, taking it off, putting it back on. We didn't want to vacillate back and forth, and we feel like now is the time. And again, based on the data, the numbers that are falling, looking at capacity, I think a lot of people get confused about capacity. And again, that's a local thing based on bed availability, based on nurses who to take care of patients. All those things are factored in. That's why it's really difficult to say any one particular metric or number is the magic number, because it all depends on your local situation. So
That's so true. One of the things we've noticed over the last couple of years is that Columbus has consistently been about 2 weeks behind Atlanta. So it kind of gives us a little bit of a predictive model, but that's something that's been really interesting that's persisted, is that we've lagged behind the peaks, and the peaks coming down about 2 weeks.
So hopefully that provides some information, some background, and some confidence in what we're doing. We realize people have varying thoughts and opinions and beliefs about everything from vaccines to masks, and we respect that. One of the things I did in my messaging to all of our employees, our parents, internal and external stakeholders, is that it is a personal choice, and for some it is a necessity. And with that in mind, we are asking everyone to show respect and dignity for anybody who wants to wear a mask, needs to wear a mask, whatever the case may be, to respect that, because that's part of what we do as part of our core values in our school system. So with that said, I don't know if any board members have any specific questions, but I just want to again thank Dr. Ramey and her counterparts for continuing to serve in this capacity for us.
Thank you so much, Madam Chair. I do have a question. You all met as a panel, and you're taking advice from the CDC, correct? And can you go over what some of those guidelines are for wearing a mask?
Can you be more specific?
For example, employees, they're saying if you've tested positive for COVID, if you're not showing any symptoms, wear a mask for 5 days and come back to work.
You're supposed to stay isolated for 5 days and then wear a mask for an additional 5 days after that.
Okay, so that's what I was asking
Okay,
you to
yeah.
go over, the guidelines,
Yeah.
so that we're clear. And then my other question would be, how are we communicating those guidelines to the parents?
That would be a question for Dr. Lewis.
Yeah, so Tracy Fox, one of the things that she does, and that's been basically her job on top of everything else she's been doing the last 2 years, she's been the point person. I won't call her Miss COVID, that'd be just disingenuous to do that, but Tracy has been working again with our medical panel and with the CDC as we get updated guidance. That's communicated to parents, and it's also available on our website, but every time a student has been identified as being positive in the school system, and again, there's a difference between being in the school system versus what happens out in the community, but when they're in the school system, people are notified of that, and then they are expected to isolate for 5 days, then wear the mask for 5 days on the current guidance. That has changed and evolved over time, as much of the science has, but that's what we're asking and expecting people to do as part of their designation. And Ms. Fox, communication goes out, again, by way of Ms. Fox and her counterparts, which are the school-based liaisons. So Ms.
Right.
Fox, you want to?
And just to add, because Dr. Lewis said it perfectly, through our communication letters, but in addition, we are by law mandated to report any positive cases to the Department of Public Health. So those parents are actually contacted through Department of Public Health epidemiology team, and they also go over that guidance. They do contact tracing with those families as well, and then notify those families who had direct contact with the positive case. So that's an additional communication tool through our public health partners.
I have just a quick question for the representative. I think that's from Piedmont, right?
And Dr. Ramey's actually our chief pediatric at Piedmont Hospital.
Okay, yeah, Dr. Raymond, sorry. But it was just a quick question about Piedmont in general. For your hospital, do y'all have mask optional also?
Oh, no, we're 100% masked 100% of the time, including our patients and our patients' families.
Okay.
Like, we
And
can't
why-
walk in the
why-
door without a mask on,
Why is that? What's the
because
decision?
because there's so much COVID in our hospital.
Okay, the people who come.
Yeah, I mean, we're actually requested by our hospital to even still wear a mask out in public. So when I go to the store, I still wear a mask all the time. Omicron is just so highly contagious. I did want to just mention, Tracy, as a parent of a Muscogee County School District student, we did get an email last week, so I can tell you the communication is working.
I have one, and if you said this, I missed it, I apologize. Omicron is unbelievably contagious. Having it once doesn't seem to protect you from getting it again. Is that accurate?
Having had that specific variant,
Yes.
well, Omicron hasn't been around long enough for us to know that.
Okay. all
Yeah,
right.
good question.
Because I'm starting to hear people say that they're having their second bout with it, so.
Well, there's certainly people who've had other variants who are getting it again.
Thank you.
But Omicron's only been around since like late November, so we don't know yet whether you can get Omicron twice. She puts her mask back on.
I guess my next question would actually be for Dr. Lewis. Dr. Lewis, do we know the percentage, and I don't even know if we can keep up with this. I
Yep.
guess HR could answer this. Do we know the percentage of our teachers that have been vaccinated? And I know we've done 2 vaccination sort of clinics. Are we
We've
planning to
actually
do
done
that
7.
again?
We've actually
7?
done 7 vaccination
Okay.
clinics.
And all of those were for the adults, not for the students, is that correct?
No, that's not accurate either. We did it for both students and parents and family members as well as
Okay.
employees.
Okay, so the students have had an opportunity, the parents and all the
All God's
employees.
children have had an
I
opportunity.
just want to be sure so that, we can communicate that. And so my follow-up question to that would be, are we planning to do that again? Because I would think that some parents, if you're going to the optional mask, may want to go ahead and get the vaccination.
Well,
for the
if you
kids or
remember,
whatever.
that's one of the reasons why we kind of gave a heads up back before Thanksgiving that we were planning to move this way so people could have ample time to get the vaccine and have it take effect and all those things. As it turned out with the Omicron variant, it gave us a little bit more extension. But we feel like there's been ample time if people wanted to do that and ample opportunities, both through the school system and through our Department of Public Health and pharmacies and so on. But Ms. Fox is going to tell you about something else we're doing
Yeah, I was just
in
going to
addition.
add, we actually are doing mobile vaccine clinics at our schools. Our schools have signed up to host mobile vaccine clinics. The first one should be actually this week, and I apologize, I don't have that school, but they're going to be doing Wednesday, Thursdays, and Fridays from now until mid-March. So we have designated schools that have volunteered as a vaccine site. The DPH will roll up their vaccine clinic and offer those vaccines to not only our staff if they wish to get a booster shot, but our parents and our students. And the schools are actually doing the communication on their own, so they'll be sending that out through their ConnectEd and their Facebook and websites.
And to answer your other question, we are not able, we're not allowed to ask who is vaccinated, who's not. We feel like we're approaching probably somewhere, I think, between 80 and 85%. Would you say that's probably accurate, Tracy, just on a ballpark based on the number of vaccinations we conducted previously, somewhere in that ballpark area? But again, I think it's important for us to start to realize at this point, I think all of us recognize the best we're gonna be able to do is figure out how to manage this. It's not gonna be a thing that we're gonna see it go away tomorrow, next month, even next year, as far as when I'm hearing from the epidemiologists. It's how we manage this and any other variants that come along. And again, we've taken a very judicious and prudent approach with this all the way back, I feel like, over the last 2 years. We've not been hasty in making any of our decisions. Again, it's been based on science, data we had at the time, and we've learned and evolved as time has gone by. Again, with the help of our medical panel who work in the field every day. These are not just researchers, they are actually practitioners. And I think that's important because they're seeing on the front lines every day, whether it's hospitals, private practices, or in Department of Health and other entities that are charged with looking at the health and welfare of everyone in our community. So certainly there's never going to be a perfect plan, if you will, that won't affect, because there are always going to be unique situations out there with people who have immunocompromised situations. But that's true with the flu, that's true with lots of other viruses. I think we're now at the point where we feel like, based on their input, we can manage this. And it's going to require all of us. But again, one thing I have said from the very outset, once the vaccine became available, is talk to your health care provider for your family and make a judicious and well-informed decision about that for you and your family's situation. That's all we can do. But by the same token, we have an educational responsibility to make sure, too, that the children have the opportunity to see, especially our younger children, see and utilize visual sight and those kind of things as far as the social cues and the other cues that are important for speech and teaching and learning. And we feel like we're doing that in a very prudent, like I say, in a very measured way. And now we're moving forward with this, hopefully, for the foreseeable future.
Mr. Cantrell?
Yes, the doctor. 2 questions. First of all, I had COVID in January. They didn't tell me what type of COVID. How do you know, or is there do they not tell you?
Most of the time, we don't test for the variant, but we use surveillance data. And between the early part of December and January, it went from almost all Delta to virtually all Omicron.
Okay.
Yeah.
It hit me like a ton of bricks, and
Right.
it seems like one day, we was doing nothing. Then
Right.
that next night I had 103 fever.
Right.
My whole family got it. I mean, really, my wife and my daughter and my 1-year-old grandson, he came down with it. So,
Yeah.
so it really got through my family. My daughter's still having problems now.
Yeah.
As far as she don't have COVID, but she has.
Long COVID.
Yes, ma'am. That's exactly right there. She's having problems. Somebody had told me something. I just want to verify it. I had my shot, but I did not have a booster shot. But somebody told me that because I had the COVID, I don't need the booster shot now for at least 60 days, and that's what I wanted to ask you.
So what we're recommending is that you wait at least 10 days from your illness, but there's no need to wait. You're probably protected for 60 to 90 days, but having had it, you don't want to be probably protected. You want to be certainly protected.
Okay,
Does that make
answers that.
sense?
Right. It just, somebody told me that, and I said, well, since you're here, let me go ahead and answer that question,
Yeah.
because I should have gotten it already, but I didn't, but I had my regular one. Thank you so much.
Of course. The only reason we initially were having some people postpone the vaccine is if they'd received the antibody treatment. We were asking those people to wait. Now that with Omicron, the antibody treatment doesn't work, so we're not giving it anymore, so that's not an issue anymore. Good. I'm glad. Yeah.
But again, we just want to be very transparent, and I thank Dr. Ramey for coming in and spending time with us long. Again, she's representing a whole group of others that are part of the process, but I just want to thank you, Dr. Ramey, as well as all of your colleagues and counterparts. We want to be very open and transparent about why and how we're moving forward.
Thank you.
Thank you, Dr. Ramey. Dr. Lewis, my question is actually for you. Can you talk about, and I'm glad to hear, first of all, that there will be multiple opportunities in vaccine clinics for parents and family in the community to get vaccinated, because we're coming up on spring break. And you had a concern about vacillating with the mask on and off, or required and not required. And so we're coming up on spring break, and we know people have already gone back to, enjoying life as we knew pre-COVID. But can you talk about your rationale for going mask optional now as opposed to finishing out the school year with the mask mandate?
Certainly, because the rest of the school year, we're looking at several months to complete the school year. And this is the time we have now seen for, I think, 3 or 4 weeks in a row, the numbers drop in terms of cases in our schools. And it's probably important to note here, I don't think at any time during the entire pandemic, we were ever above 1% in our school district in terms of the total number of students that had COVID. But at this point in time, we're looking at basically throughout our community, we're seeing people going mask optional. And we feel like that based on the medical input that we had from the experts, that it was the time to do that, to be able to do that. And there was no need to continue this for an entire rest of the school year. I'm not sure when the right point is, but the point was that the medical panel felt like it was safe to do this at this point. And again, the point is we're going to be managing this going forward, not eradicating it. So this is the time to do that. That's the, and again, this was not my rationale. This is based on the rationale of the medical experts, based on what they're seeing and experiencing in their practice.
Right, but they weren't advising to go mask optional. They were just advising you of the current conditions and the trends.
No, they actually said it was time for us to consider going mask optional.
The medical panel
Yes.
told you to do that. Okay. Any other questions? Turn your mic on. I'm sorry.
It is. She's got a green.
Oh, I'm sorry. There we go.
Thank you. Okay. I was just saying, that's good to know, Dr. Lewis, about the medical community who has worked with us the entire year.
2 years.
The entire couple of years. It's good to know that they were the ones who made this decision, because we are able to tell people, we've been having phone calls with people concerned about this change of mask optional, and we are now, and listening to this meeting, we're able to say that the decision was made from the medical communion.
Yeah, let me clarify. From the
I mean,
beginning, I made the decision.
Based
Like
on-
it or not, I'm the one who made the decision.
Based on,
Based on the recommendation of the medical experts. And
Okay,
that's
now-
been consistent for the last 23, 24 months. So I want to be real clear about that.
I think we know that.
Yeah.
'Cause
Well, but there's a difference
can't make
between
decision.
recommendation and
Yeah,
making a
because
decision.
anything we vote, anything we do here, it has to come from Dr. Lewis, and we have to vote on, or say yes or nay to that. But yeah, but I'm just saying, and maybe I should have phrased it better. You made the decision based
Right.
on the medical
Correct.
community who has been working with us the whole year. And I wanted that point to come out, and I think
Yes.
that's what
Thank
Ms. Green did, because we've had people concerned about the decision. And so we can always say, based on medical community who is update with the data and what's going on in the city and school systems all over, and particularly in Columbus, Georgia.
Yeah, I've got enough to say grace over right here. I don't need to worry about what's happening all over the rest of the state and country. But that's why, again, I want to go back to, and I want to belabor this, but I want to make sure it's clear. Because I've had a number of people weigh in with all kinds of thoughts and opinions, none of which are accurate. But nonetheless, I want to be real clear. We took the guidance from the very outset, whether it came from the CDC, whether it came from the Department of Health, whatever it is, there's no one national message that's going to fit every single community situation. So from the very beginning, we took that advice and those guidance pieces that came from the national and even the state level, and then vetted those through our local medical panel based on our local conditions here. And I think that's really important because, now, granted, when we get closer to holidays and people are traveling, you have to take that into advisement and that kind of thing, and that's exactly what our medical people do. Fortunately, our medical panel had a very far outreach network to work with. For example, Dr. Ramey, she's on a national pediatric board, and so she had contacts all throughout the country which we benefited from throughout the process. So we've been very fortunate to have the people we did on our panel. But at the end of the day, we did vet everything through our local panel based on local conditions to render our decisions. And the decision was ultimately mine to make, but it was based on the recommendations all the way through of the medical experts. So I just want to be clear on that.
Most decisions are made in context. I would like to go back to national trends also. Local decisions are made with local conditions, but when decisions like these are made, where life and death and something of this variant, consideration is also given to national trends, state trends, and then the city in context of everything else that's going on.
Correct.
Okay, thank you.
Anyone else? All right, we're ready to move on to our public agenda. We have 3 individuals signed up to speak to the board on our public agenda. Ensign Gordon, Janice Granville, and Anastasia Brant. If Mr. or Ms. Gordon is here, if you would please make your way to the podium. And while we're readying for this, I will read that this and all official meetings of the board shall be open to the press and the public. However, the board may meet in executive session. Citizens are encouraged to address items on the board agenda or to initiate presentations of issues appropriate for school board consideration. The board meeting is not the appropriate place to review individual employee performance or individual parent complaints that have not been addressed by the principal or superintendent. Citizens are encouraged to follow our normal channels to address such problems, which would be a phone call to request to speak with your principal, go through the chain of command at your child's school or at your workplace, and then on up to the superintendent. But to get on the public agenda, you do so by calling the superintendent's office or emailing Ms. Karen P. Jones on our website. So there's Gordon at the mic. Ms. Janice Granville is next. You go to this microphone right over here. Ms. Granville.
Good morning, fellow Columbus citizens and school board.
Good morning.
First of all, thank you all for giving me just a few moments to speak on this matter.
And I didn't tell you you have 5 minutes. You have
Okay,
the timer
let me
up there.
speak quickly then. A few parents were concerned when the letters first went out that we were going to go mask optional. We did put together a petition and we began to circulate it. It has garnered more than 150 signatures, and the essence of the petition is this. I'm going to read the letter. I also sent this letter to each one of the school board members as well, just to let them know my concerns. But the notice below is extremely concerning. This had to do with the email. Why would we consider this change now? Each Friday, the numbers put out by the school system are greater than they were before this new variant. There are numbers, these are the numbers we are asked to look at as parents. Kids are going home sick all the time, regardless of whether they learn they are positive or not. So obviously germs are spreading even with masks, and consider what this will look like when we take the mask off. Also, please, I ask that you all consider these guidelines and how they will look when they're put in the hands of children. Children will be the ones who decide if they wear a mask or if they don't wear a mask. It is not going to be left up to the teachers to decide if those parents told them when they came to school, you're supposed to wear a mask. You have a mother who's compromised. You have a grandmother who's compromised. You're compromised. Make sure you keep your mask up. No longer will that be the responsibility of the teachers or the administration. It will now be in the hands of kids that are 7, 8, 9, 10, and so forth. That's a concern as well. Unless there is new data that shows a substantial increase in the percentage of vaccinated children in Muscogee County, we have no reason to believe our children will be safer now than they were 6 months ago. Well, clearly, we just heard that we do not have a substantial increase in the number of vaccinated children in this county. As a matter of fact, we have a very low level of vaccination of children, and most of them vaccinated are over 65. I do have a serious concern after hearing the comments today where the professional said that this is to encourage people to be vaccinated. With all due respect, we've been encouraging people to be vaccinated for the last 2 years, and we only have a 47% vaccination rate in Columbus. Taking the mask off, I don't believe is going to change anybody's opinion as to whether they vaccinate their child. So if that was the purpose, is to encourage, I'm concerned that that will not occur. I also am putting parents who live in the counties, and without going into all that, I admire this school board and what you all have done. You all have made hard decisions in a very hard time. You've done surveys, you've done groups, you've assembled panels, all those things to keep our children safe. My question is, what is it about this decision that makes our children safer? And if the answer is this is not about safety, then my question is, what could be more important than the safety of our children? We always say you weigh the pros and the cons. If the pros of making it mask optional allows for parents to feel that their children will have a more emotional connection to their teachers, I think that's necessary, that's great, but it does not outweigh safety. There's no reason for me to believe that there will be less cases of COVID with masks being optional than there will when masks are worn on both sides. As a matter of fact, the American Pediatric Society did a study in February to show for counties that were considering coming back from virtual, that as long as there were 2 masks on both sides, they could actually reduce the quarantine. They could eliminate the quarantine, which our county did. I was very concerned about it in September, and I shared that with Dr. Lewis, but when he actually did it in November and December, it made sense to me. The numbers showed that when 2 kids have a mask, that the secondary transmission of COVID was little to none. But now we're taking off one of those masks on the other side, and in some cases, both masks. What makes us to believe that our students will be safer? I got an email from my school today of parents who want purifiers for their classrooms and asked if the parents would agree to donate money for purifiers. That makes me concerned. That means there are some teachers that are concerned that they're not safe in their own classrooms. And now they're asking parents, will you help to provide these things? I don't understand the urgency. I believe we did the work to make the right decisions before, but I don't understand what the urgency is on this side to take off the mask from these children at this point. My children wear a mask because of their grandparents. They wear a mask because they have asthma. They're hoping that they're fine. I can't stand these things either. They really do bother me. But I'm asking you, how does this decision make our children safer? Is safety not the most important thing here? Or does it at least outweigh the reasons why we changed it? I've yet to hear, honestly, today, what was on the other side of that decision. I understand the visualness of students, and especially young kids, but tell me that that doesn't outweigh the safety of these children. That's all I ask. My last question is, what will it take for the mask to go back on? How high do the numbers need to go in order for us to change the decision? What are the characteristics or the numbers that we're looking at to determine if they have to go back on? Because I don't know the numbers that were used to determine that they came off. Thank you.
Thank you, Ms. Granville. Anastasia Brant.
My name is Anastasia Brant. I am sure that many of you recognize my name, even if it was while you were deleting my emails rather than reading them for the last 17 months. Before I start, I want to say that I'm the product of public schools. I am also the daughter and granddaughter of public school teachers and administrators. I don't envy any position of power in this climate, but I also do not tolerate the abuse of such power. I've had this speech ready for 2 weeks. When the school district's position on mask changed to optional, I knew I'd still be here. I knew that you've changed your mind twice now, and I knew you constantly remind us of the power you have to change it back. What possessed you to decide that optional masking was a good idea now? I rarely have felt sympathy for the other side of this, but I do right now. What are your parameters for these mitigation mandates? I've been asking this for 17 months. I am not talking about vague, convoluted answers such as it depends on the local situation. Case numbers are higher now than they were a year ago. In fact, they're 3 times higher. Further, you had stated that numbers have been decreasing the last couple weeks, and that is simply not the case according to Muscogee's website. Numbers were decreasing a year ago. We were in the single digits, and the mask mandate was not lifted. So why now? What has changed? You are being as vague now with the information as you were a year ago. Every parent deserves answers, and you won't give them. Do you believe that we aren't bright enough to process the information you're using, or do you think that we're not entitled to it? Or, and this is my personal belief, is that it's just a magic 8-ball at this point. You have a medical panel that's full of other professions you rely on for your decision-making. You have medical, legal, and the risk side covers, and you have teachers and employees covered, but you don't have any parents. Students aren't represented at all. I was told last year by Tracy Fox that you could include a parent rep in this mix. You haven't. I have emailed Dr. Lewis and Tracy Fox about this again and have not gotten an answer. Dr. Lewis, you told me how you walked into classrooms last year and that children were behaving just fine. But did you ask them? Did you sit down and say that you genuinely care about their response? I just don't think so. There is also no child psychiatrist on this board, which amazes me. I have some masks here that my son came home with last year. They have holes cut into them, breathing holes. I asked them if he at least took his mask off before cutting them. No, we're not allowed to, he replied. You tell me that children are resilient. Children shouldn't have to be resilient for the rest of the population. They are not responsible for our health. We are responsible for theirs. My child does not need to be resilient so that you feel safe. My child is resilient. His father's deployed, not for the first, second, third, or fourth time. This is his life. My child is more resilient than all of you combined. But that is no reason to abuse our children. This is causing negative academic impacts and psychological and emotional trauma that we will be dealing with as a society for decades. Masks were what pushed us to decide us to homeschool, but of equal importance is the decision, the fact that we weren't even allowed to walk through school doors. You've been secretive with the way you make decisions. I want to know what you're hiding behind those doors. When will parents be allowed in again? When will parties resume? When will we be back to normal? What are you telling our children? Are you proponents for re-educating them? My child when he walks through the door? When my husband and I first started speaking out about this, we were aware of the potential backlash. However, I will not say to my son ever that I idly sat by and allowed people to scare us into submission. I'm not scared. I find it very interesting that in your personal lives, many of your behaviors have not reflected the stance that you have taken when it comes to the district's mandates. Because I have more respect for you than you appear to have for us, I'll leave names out, but it appears as though one of you has a son who attended prom last year maskless. However, I don't recall this person or any of you advocating for a prom in Muscogee. Another of you, one who replied to my emails, along with Dr. Lewis, replied that you are a parent of a Muscogee County School District student and that you believe that masks should be optional in Muscogee County. I replied to you but got no response. It appears to me that you are more afraid of your fellow board members than for fighting for what you believed. From referring to people as COVIDiots, to laugh reacting when a parent asks a question on Facebook, to suggesting that parents are not capable of teaching their children at home, and furthermore, that part of the job of public school educators is to fix what's been taught at home, is a board member that never ceases to amaze me. This member's contempt for parents and Dr. Lewis and the rest of the board's silence in response to the outright hatred for ideas that differ from his or her own reduces the already tattered credibility of Muscogee County schools. Rules for thee, but not for me. These are the people that are responsible for making the decisions for our children. I am appalled, saddened, and disgusted that in the past, until this meeting, I have not heard any of you publicly stand up for our children in either direction. I've talked to countless parents on both sides who say that they receive zero response from you. You are elected officials, and I'm thinking that you have forgotten that. The charade of fear-mongering, pretending to be the better people, virtue signaling, and dictating how and when our children need to go to school needs to end. It's a circus performance. In closing, I'm wondering, one last question. When will you take this theatrical production to the Springer?
Thank you, Ms. Brant. Thank both of you for coming. We do appreciate your comments and participation in the public agenda session of our board meeting. Okay, now we will go into our committee reports. We have Education Committee. We have a presentation.
Thank you, Ms. Green. We have two items on the Education Committee, and I see them coming forward. They're discussing our literacy resource adoption.
Good evening. Lori Watt, Executive Director of Curriculum Instruction and Professional Development. Thank you all for this evening, and what we will be presenting to you is our literacy adoption for 6 through 12. Do I have the... I just tried. Okay, sorry about that. Literacy in this case is going to include not only our English language arts, but also our world languages, which we have not had an adoption for in probably close to 20 years. But we have also understood that the materials we had were digital at the time and were being updated to some degree. So we haven't, it's not like we haven't adopted a full force curriculum, but we have had different supplemental resources through that time. I also want to introduce this evening Margie Riles, who's our secondary content specialist for ELA and world languages. She's standing behind me and will be going through the materials that we are going to be presenting tonight. We had asked that if anybody on the committee of teachers who actually sat with us and went through and evaluated the materials could be here, but I know it's a busy time. And we do have with us, though, Stacy Martin, who at the time was an ELA teacher at Double Churches Middle and is now our new director of virtual learning. So she did sit on this committee as well. World languages in this case is going to include Spanish, French, Italian, and Latin. And if you know me and you've sat through the many adoptions, you know that I go over the logistical pieces, and you can stop me when you'd like, but this is the timeline of what we went through this school year. We put together the committee, which was through September and October. We had recommendations from principals and region chiefs. We had people from multiple departments, including DIS, PES, ESOL, and we looked at all aspects, including the technical. We reviewed the Muscogee County School District policy and guidelines for textbook adoptions. Then we secured the criteria for this particular evaluation of textbooks so that we would be consistent throughout. We requested the samples from selected publishers to be sent to Muscogee County. We actually requested lots of materials and looked through them. It wasn't just a few select. There were a number of publishers that sent materials. In October and November, the initial district committee meeting was held where we went over all of the guidelines and the criteria that would be used to go through as we looked at the materials. We evaluated and reviewed the materials. The evaluation team did, and then we completed instructional materials evaluation rubrics and reviewed those with the committee members. The top publishers were identified, and once those were communicated out to those publishers, they were invited to present to our district adoption committee. Originally, it was going to be in March, as it indicates there, but we were actually ahead of schedule, and we had those presentations in December and January. The presentations are as follows on this timeline: December 1st, 2nd, and 8th. And then again, there were there were a couple in January for like Latin, where we have very few students in the district. So those smaller adoptions we did save and look at. And tonight, we are here recommending what the superintendent and this committee of teachers from across the district have decided would be the best choice for the Muscogee County School District. When we were looking at criteria, this is going to apply to both. We have two slides, but it's actually going to apply to both ELA and world languages. We looked at the content, the organization and presentation, equity and accessibility, instructional design and support, the assessment pieces and technology, and whether or not they would meet the technical requirements within our own learning management system, which is Canvas, as well as our networking requirements. Our final selection to you, or recommendation to you tonight, is Sabbas, which recently was the name changed. You might be more familiar with Pearson. So this is Sabbas Learning Company, and we are recommending My Perspectives for 6th through 12th grade ELA, and then Vista Higher Learning for Spanish, French, and Italian. I'm going to leave the actual titles of that to Ms. Riles. And then Latin for the new millennium for our high school Latin classes as well. And I'm going to turn it over to Ms. Riles at this time to go through the products to show you what we saw and what the teachers really liked about these particular products when they used the rubric, and these particular products came out higher than the others using that rubric. So, Ms. Riles?
Hi. Like Ms. Watt said, I'm Margie Riles. I'm the literacy content specialist for the school district. I've really enjoyed working with all of the teachers on this review committee while going through this whole process of picking out resources. So tonight I'm just gonna give you the drone view, so to speak, of these products. So as you scroll through the presentation, there are links on the various pages that you can click on. So if you want a little more in-depth information, you can click on those links, and that's where you can provide, those links will provide you with more in-depth information. Also, please know that all of these products do support integration with Canvas and also Clever as well. Okay, so for My Perspectives, this is the ELA product for grades 6 through 12. Every student will get a consumable text for 6 years, which will be delivered at the beginning of every school year. There's also an online learning platform for students as well. And in the past, we've purchased Turnitin.com separately, but Turnitin.com comes with My Perspectives along with Revision Assistant. Then also students get 2 novels each, and then they also have access to other novels on the platform as well. ILIT 45 is the remediation component of the Sabbas product, and so I have a slide devoted to that product specifically, and I'll tell you about that. So features of My Perspectives is that it supports the standards and that each unit is centered on a theme. It opens with an essential question, and then there's a focused writing for each unit as well. So argumentative writing, informational writing, narrative writing. There's something called a launch text, which is what launches the theme of the unit. And then then the unit is divided to help teachers with instruction. So there's text for whole group, small group, and independent learning. The whole aspect of My Perspectives is focused on personalized learning and differentiated instruction. So the teacher can help decide what ELL students need, what strategic support is needed for students, or if students need to be challenged. One of the features that the teachers really liked of this product is that in the Teacher's Edition, there was a pacing guide that ran along the bottom of every single page, so they knew where they were supposed to be or wanted to go, and they didn't have to go consult another resource to find out if they were pacing accordingly. My Perspective also has assessments, and the teachers have access to real-time reporting, detailed information on standards mastery, progress, and usage. And at the beginning of the year, a diagnostic test can be given, and then it can be given again in the middle of the year and at the end of the year. And again, this is based off of standards mastery. There's selection tests, unit tests. There's also test banks, and all of this is editable, and it can be downloaded in PDF form, and the teachers can add their own content to it too, which was, again, a feature that the teachers liked. The digital component of My Perspectives, this is just a snapshot of what that navigation would look like on the screen when a teacher or a student would open it. For example, a teacher could click on the word standards and they're automatically brought to resources aligned to specific standards. This is where the teacher's edition is located, or the digital component of the student edition. This is where turnitin.com is located as well for plagiarism checking, or it's also part of Revision Assistant, which Revision Assistant gives students immediate feedback on their writing, and that's one more avenue that students can get feedback on their writing that just doesn't come from the teacher. There's videos for engagement, current events. Teachers can customize existing content and add their own content to it. Again, a feature that the teachers really liked because it supported personalized learning was that there's playlists already there that are ready-made for teachers to use, or a teacher could customize it based off of the data that they got from the assessments for their students. Everything is downloadable, and the students can annotate the text, which then goes into their digital notebook. For ILIT 45, it's mostly designed for high school students, ILIT 45, and it's designed for students who are 2 to 4 years behind and who lack basic reading and writing skills. The instructional model is based off of a 45-minute period. So the model is based on time to read, vocabulary, read aloud, think alouds, classroom conversations, whole group work time, and then a wrap-up session. And then within that instructional model component, the students are focused on comprehension, fluency, phonics, and vocabulary. By focusing on adolescent interests, ILIT uses trade books through a library of online level text by Lexiles. The ELL students can use this as well, and ELL teachers were also part of the resource committee. There's also opportunities for assessment and reporting with ILIT 45. So teachers can receive student summaries, class reporting, there's district reporting, and then with these assessments, again, there's beginning, middle, and end of the year assessments, and so that you can determine when the student would enter the program and also exit the program. For VISTA, for the world languages, VISTA was the vendor or the publisher that the teachers liked the best. I am just going to go on ahead and tell you that I am going to totally bomb the pronunciation of all three of those titles, and I apologize as the world language content specialist. But they chose Encuentros for Spanish for grades 6 through 12, Chamiens, you don't say the N and the S, I do know that, for French, and then Sentieri for Italian. With VISTA, same thing, teacher and student online access to the super site. That is the digital platform for VISTA. There's digital text, hard copy text, interactive chats, and culturally relevant videos. About the super site, this is where teachers have access not only to their teacher's edition and students have access to their student editions, but also there'll be hard copies given as well to teachers for their teacher's editions and to students as well. It supports the standards, it supports can-do statements and teaching using proficiency levels. There's up-to-date engaging videos for students on the super site involving culture and grammar. One of the features that the teachers really liked was the interpersonal exchange because they could do peer-to-peer chats. And then what the PES teachers liked on the review committee was that there was a transcript that was running while they were chatting. There's also guided reading, which it reads aloud the targeted language to the student, and then it highlights those words as well that are being read aloud in Spanish or Italian or French. There's also performance assessments, written, verbal, project-based, and then same thing, there's then data that's given to teachers in real time for standard mastery. Okay. For Latin for the New Millennium, same thing, their digital access is called Lumina, and they have access to it digitally for the teacher's edition and for the student edition. There's also hard copy text that will be delivered to teachers and students as well. The on-site Lumina provides foundation with vocabulary, grammar, morphology, and essays. And then with the student edition and the access to Lumina, students have so many avenues to learn with activities, assessments, that it just goes on. And again, this supports Canvas and Clever as well. And then for professional development, all of these provide an in-depth professional development plan. There's training involved, there'll be walkthroughs, and then there'll also be virtual sessions offered as well throughout the year for all three of these products. So thank you for listening. I've really enjoyed, like I said, having this opportunity to work with teachers and to learn about all the resources that are out there, especially for world languages. And I'm looking forward to hopefully working and implementing with teachers and students for this to happen next year. So does anybody have any questions?
I do have a question.
Yes, Inspector.
I was speaking with a teacher, middle school, I believe, that was very excited about software or program that was doing some grading of the writing content. Is this that program?
Yes, the revision assistant component of Turnitin.com does help grade the student writing.
No, it was a different name.
What did you, it was, there, maybe it was with the other vendor that probably also presented as well.
Okay.
And that other vendor had major problems with their website that day.
Okay, but this will do that same.
Yes,
Will give the teacher
will.
the same opportunity to not have to grade the writing as much.
Correct, yes, that is correct.
Okay. Ms. Chambers? Okay.
Thank you so much. Great presentation. You mentioned that there were 6 years of consumable text.
Correct.
So I'm assuming that there is no textbook that goes with this, that this is some type of workbook
No,
that they're
it's
working
the
in?
actual textbook, so the students can write in their textbook.
Okay. The word consumable is what made me think it's a
Oh, okay.
workbook because,
Well, correct. In the past, that's what they've been called, yes.
Absolutely.
But no,
Okay.
the consumable text has taken the place of the actual hardback book.
okay, but that student permanently keeps that book. Okay.
Yes, ma'am. Yes.
Okay. So this is English language arts, so there's no anthology or anything like that, no collection of books?
It is, it's the student text. I mean, you would have to see the size of these consumable student texts. Some of them come in 2 volumes.
Okay. Just a couple more questions. What are we using before this adoption, or before we approve this adoption? What were we currently using? And then the assessments are important to me. You mentioned differentiation of education.
Yes.
And so those assessments are gonna help the teachers do that. But do they go over ZPD scores, Lexile scores, grade equivalency, things of that nature?
So for the Sabbas product, there's assessments, like I said, built in, whether they're teacher-driven or they are standards, base driven, in order to provide that data back to the teacher. And then what's really awesome about the My Perspectives product is that there are actually sections in the book that's divided that says, the teacher does this. If the student does this, then you go to this chart, then you go to this chart, or you go to this chart.
So it's a diagnostic for each individual student?
Correct, and it actually changes while the student is taking it.
Okay. Okay, so
Yes.
you can track the student
You
and you
can.
can measure progression
You
from
can.
start to finish?
Yes.
Okay, sounds good. Let me see. Do we currently, what are we using now?
Oh, I'm
I'll
sorry,
ask
yes,
that
I
first.
forgot to answer that. For ELA, we're using Houghton Mifflin Harcourt product, Georgia Collections is what we're currently using, and that contract ends in June or July. For world languages, it's a 20-year-old product, Bien Vieja, and I might be saying the good old lady, and
Okay,
I
I
know a good
know,
old woman.
I'm familiar with both of those. I know what you're talking about.
But, sorry, but that is the product, and there's no digital component with those books at all for French, and then Italian is just started this year at Hardaway.
Okay, and my last question, I guess, about this is, well, twofold. Are we measuring like the literacy rate of our students at that 6th grade through 12th grade?
Like literacy rate, like with Lexiles?
Lexiles,
Yes.
yes.
We have several actually components in place that do that. For middle school, we have Power Up, and then Achieve 3000 is used for 6th through 12th. For high school, that's the reason why the teachers really liked this ILIT 45 product, because Power Up is used with a very selected population at the high school level, and they found that they thought this ILIT 45 product would be beneficial to the students at the high school level for what you're talking about in regards to the literacy rate.
And the differentiation.
And the differentiation. The whole thing with ILIT 45, I mean, it's all about personalization. That student is working on his or her literacy based off of the constant flow of communication and the information that's coming back from the assessments.
Okay, sounds good. All right,
Yes.
thank you so much. I was
Okay.
trying to see if it aligns with, we've spent a lot of money on Achieve 3000s and things of that nature. So I was just trying to make sure that they align and they're gonna complement each other.
Correct.
And we're not reinventing the wheel with this new,
Correct.
series.
Yes.
Okay, sounds good.
Okay,
Thank you so much.
thank you. Anybody else? Yes, Ms. Buckner?
Yeah, I just wanted, first, thank you for teaching my child. Very good teacher.
You're welcome. She was a pleasure.
And also, now, it actually sounds really good. It sounds like true literacy, you know, as I hear you explain. It sounds like a very good literacy. But I was going back, I heard Ms. Chambers say something about turnitin.com. Now, doesn't that have a component for plagiarizing too?
Yes, for turnitin.com, yes,
Yeah.
which is what we've already been purchasing every year, but we've just been purchasing the plagiarism checker component of turnitin.com. So, yeah, so ELA teachers will have access to the plagiarism checker for turnitin.com and this revision assistant.
Okay, because, yeah, I remember as my child was in school, many of the kids, before the teachers graded them, they got their papers back, you know, before even,
Right.
and that's a good thing, you know.
Yes.
So, and it helps teachers too, so when they sit down, they have an actual document of children's work. But it sounds good, because I was listening to her when kids are working from their own work, you know, they're working from their own work, when the work that they produce in the literacy.
Yeah, the teachers were very excited about the Sabbas product, extremely
sounds good.
excited. Yes. Anyone else? Yes.
You may have covered this. Did you all talk about cost?
It's in there.
Okay.
I promise.
Is that in our attachments? I'll call myself looking.
attachment to that, it's down in the attachments in the finance section.
Oh, well, we haven't gotten there yet.
Yes.
Okay.
Yes, okay. Okay, all right, okay. Anybody else? Oh, yes, I'm sorry.
Questions. So that grading proponent, that is something the student can also access before they turn in a paper.
For the revision assistant?
Yes.
Yes, that is correct. It looks like on the slide, I tried to do a snippet. It looks like little Wi-Fi signals, so it goes up and down depending on where the student is with that specific component of their writing.
Okay, so, but if they have to turn in an essay, they can kind of do it through this and help them
That is
maybe go
correct.
ahead and shore up some mistakes
Yeah.
that they made.
Well,
Kind of
that-
like
well-
my children used to let me do, and now I think I might have been overzealous and they stopped.
Well, that's right, and then also too, whatever feedback they get from that, that can be the conversation starter between the student and the teacher, you know, and it's just, again, one more avenue where it's not, you know, don't get me wrong, it's great that the teacher provides the feedback, but it's also just coming from another source as well.
And then you said they could access books as well online through it?
Yes, yeah, there'll be hard copy books and well, for world language, hard copy books. For ELA, they're consumable texts.
Okay.
And then it's also found on the digital platforms as well.
And then within the languages, I mean, will this provide an opportunity that some children that are really, I shouldn't say students, they're in high school, to kind of dive deeper and maybe go further
Yes.
than what the basic curriculum is?
Yes.
I like that a lot,
For
yeah.
Spanish, it's a culturally based units.
Mm-hmm.
And then for where grammar and vocabulary are incorporated within the culture, the videos that come with it are culturally relevant and current.
Mm-hmm.
You know, they're not 10 or 15 years old, so it really engages the student and it appeals to them like media that they would see now. And so, yes, the world language teachers are just absolutely ecstatic that they have been part of this resource adoption and looking at all the resources that are out there. So they are very excited about what they hopefully will get.
Yeah, I can understand why, thank you.
You're welcome.
I just want to make a couple of real quick points. Again, this really highlights the focus on personalized learning that I think is something that we all want to continue to support because it is our focus for our district. The other thing too, from a standpoint of the teacher, this moves us to that one-stop shop where we can get it all located in one place on our technology platforms. So they're not having to go lots of different places to find videos, supplementary or complementary works. It's all right there, one-stop shopping, and that's really one of the things we're trying to accomplish is to make it easier for a teacher where they don't have to go out and spend a lot of time pulling this together. It's right there accessible to them. And then the eyelet, I particularly like this because in light of what we've gone through the last 2 years, students will be able to shore up individually some of the areas that they may have been deficient in because of the loss, I won't say learning loss, as we talked about, the loss of learning opportunity that they experience. So this is going to allow us to help address those individual needs. So I think there's a lot of benefits to it and the fact that the teachers have been so supportive of this. But I also want to thank Margie and Lori because this is, as you can see, it's a very elongated, protracted process to make sure we get the kind of feedback based on rubrics that's so important. And I know I speak for Margie, but also for all of our curriculum and content specialists who spend an extreme amount of time trying to make sure the process is really a tight, quality process that when we get to this point, we're providing you with a recommendation, provides quality, high-quality materials, instructions that takes into account individual learner needs and ease of use for the teachers, as well as all the technology aspects from a technical standpoint. So thank you both very much for your consistently good work in ensuring we have good quality products in front of our kids and teachers.
And thank you, Dr. Lewis. I appreciate that, but I really need to thank Margie for this one in particular. We normally do one adoption and the amount of time it takes to do that, and she has actually essentially done 5 with 4 different languages and an ELA, but that's 6 through 12 as well. And the teachers that came and evaluated the products, it's been a massive undertaking, and she did it with such efficiency and professionalism. It's been a really smooth process, and I just want to thank her and the team for all that they did.
Also, I mean, we're gonna all say thank you, but, you know, I'm really excited and glad to have this presentation tonight because I had already started getting feedback from teachers about their favorite pieces of this new adoption that was coming up. And so I think job well done, and I'm looking forward to it benefiting not just the teachers because, you know, they're excited about teaching and unlike me, they could teach a rock, you know, to swim, but the students having an opportunity to continue owning their own progress and owning their own work and owning their own pace, catching up or getting ahead is really beneficial and exciting aspect for me as well. So thank you all for.
That brings up a very important question. And thank you so much, because I've served on the district adoption committee before, and it does take months and months of work. So thank you for all you do. My question was, who sits on the district adoption committee? I heard you say teachers. Do we have any parents that weighed in on this at all?
Our policy doesn't include parents on that. Our policy includes parents when they are to be reviewed. We will put materials out for review, just like we would for every product, but also I know that there's some proposals out there to make sure that there's going to be reviews every 9 weeks, I believe, is what's coming up. But we've always made our products and our resources available to parents, and they will be out on display for review. We usually put that out to the schools, letting them know, to let parents know where the materials will be. But to be honest, we don't get a lot of participation in that for parents to come up and look over those materials. But hopefully that will change when it becomes more of a focal point this year.
Okay, sounds good. Thank you.
Little preview, you'll get elementary math next year.
Okay.
Thank you so very much.
Any more questions? Okay, now, are we, what is he there for? Okay, we're going to that. Okay, and now we're going to our a second item on my committee is the new Sex Education Advisory Committee. Okay,
Good evening, Board.
Mr. Battle.
Jeff Battles, Curriculum Instruction Specialist for PE and Health, which includes being the chairman of the Sex Education Advisory Committee. This committee has not met in a few years, so we had to reform it with new members. The reason for reforming the committee is to go review our current sex ed curriculum as we move forward with some changes from Godot, from the Georgia Department of Education, some of the things they're asking us to do in health and PE. One of the things we wanted to do was review our sex ed curriculum. We have chosen several members of the committee. Each one of you was able to nominate one person from the community to be on the committee. We have 3 students on the committee from Carver, Northside, and Kendrick. We have a school administrator from Spencer on the committee, and then we have 2 health teachers from Columbus High and Hardaway High School that will be on the committee also. We will also have Dr. Tequila Nelson, who will be meeting with us to talk about what we do at the elementary age with our counselors through sex education. As we get closer to meeting time, which we're hoping to meet sometime in March, Ms. Jones might be contacting you directly to get the contact information for your particular committee member so we can set up a date where everybody can come. Yes, ma'am. We are looking forward to reporting back to you in April or May, hopefully with, diagrams and pictures for you.
Oh, no.
Of our new curriculum. Of our new curriculum, yes, ma'am.
Oh.
Yes. Yes. Yes.
Okay.
We want to show you what we're teaching them in our curriculum. Yes, ma'am.
Moving along. Are there okay, are there any more
Thank you, Mr. Battles.
Okay, Mrs. Green, before we get into more trouble, that concludes the Education Committee.
Well, it is Valentine's Day, but moving on in the spirit of loving everybody, we'll move on to our Discipline Committee, which has no items. Next, we'll have Property Committee, Ms. Chambers.
Thank you so much, Madam Chair. Item 5.01 is the appointment of library board members. There have been several members of the Muscogee County Library Board that has You guys ready? They have rolled off in December. So we have 3 recommendations: Susan Berry, Sir Michael Jones, and Robert Landers. The new library board members were appointed at the January 27, 2022 meeting of the library board and recommended for consideration by the Muscogee County School Board. The following board members will reach the end of their first term on the library board where they met it in December 2020 and are eligible to serve a second term. And that's Beth Swartz. Thank you. Alan, I appreciate that. And Todd Robinson. Okay, the library board members were approved for a second term, January the 27th, and now they're bringing it for the board to consider these names. So this is a voting item. Any questions, board members, about 5.01? Okay, hearing none, I'll go on to 5.02. 5.02 is the library report, and it is attached. Yes.
I just wanted to say that I enjoyed doing the winter reading challenge. I thought that was a great idea. I personally was kind of going to binge watch TV until I saw that, and then I thought, well, I should read. So anyway, I thought that was a good idea, and I like the promotion of it, so thank you.
Okay, very good. Any questions about the library report that's attached, board members, and all the wonderful things that are going on at the library? Okay, hearing none, I'll go on to 5.03. That is the museum report, and it is attached. I know we talked about this last month, but there were 2 new exhibits during January. One was called The Journey Towards Justice, and this was the civil rights movement in the Chattahoochee Valley, and quilts from the collection of Paul Goggins. And that was part 2 on January the 15th. There was a full day of activities and guided tours. And for February, we're looking forward to welcoming students for more guided tours on the journey towards justice. Okay? Any questions about the museum report? Sure.
Just want to say too, I know Ms. Hughley Green and I were at the Art and Bloom the other night that was at the museum, and just what a nice, kudos to our administration that helped put it on, but what a nice venue it was to see our middle school and high school art exhibit, and I believe the elementary school is going to be at the end of March, I think. Yeah. There were a lot of people there. It was so pretty.
Oh, awesome.
And it was just dazzling. I know
500.
it made the artists feel very good about their work. Thank you.
Do we have a limit for this year? Was there a limit? 500? That's a lot.
Just the parents.
Okay. Okay. Sounds good.
I think it probably was a lot of people because there was some expansion too of the arts. You included the performing arts. And that was simply if it could be a perfect touch or addition, that was it. And to have that all going on simultaneously, where people could kind of move around and look at everything, including the exhibits that are always there in the museum, in that same area, was simply stunning and amazing. It was an awesome opportunity. And the artwork from the teachers actually participated. That was quite amazing, and they were all there to support their students. And so people just made it a family affair, and probably just cabin fever, and just, yeah, so was I. And the work was phenomenal, and the performances were too. Reigning McCullough School of the Art students in their performances. So that was simply stunning. Great idea. Looking forward to it. I don't know what happened to your mic. Did you turn it off?
Thank you so much, Madam Chair. Mrs. Buckner, did you have some comments you wanted to add?
I was going to wait till you finish because I have let the library report pass.
Okay, go ahead.
I want to go back to it.
Okay, go ahead. If you'd like to go back to the 5.02, library report. Did you want to add something, or you have
No,
questions?
I was just gonna make a comment, and,
Okay.
and of course, I was
Sure.
gonna make it in the spirit of Valentine's Day. I was looking at the service stories where 2 teens used the teen department as a meeting place for their blind date. And I took note of that since our library is good for many things, you know, but now, I do, and I will add that they were discussing, somebody heard them discussing the books to be read on the list, so they were discussing that. But they use the library, so it's used for many reasons, and I said that in the spirit of Valentine's Day.
Thank you so much, Madam Chair. I do want to say, in all seriousness, we have a lot of things going on at the museum and at the library. It is free to the public, and I think that we are lucky to have the relationship that we have in Muscogee County with our library and with the museum, and I would hope that the public would take advantage of it. It's a gem, so thank you guys for all you do. Okay. Hearing no further comments on the library or museum report, I'll move on to 5.04, which is the surplus of library books. And this is where the Columbus Public Library is requesting that we approve to declare the attached list of library books as surplus to the Muscogee County School District. These library books have been weeded in accordance to our collection development policy. The library is requesting that they are able to dispose of these books through the bidding process, through a public auction, online auction, donation to public entities, or sell them to another government entity. So we'll be voting on that as well, board members. Any questions? Okay, hearing none, I'll go on to 5.05. This is also for us to approve to surplus the attached inventoried operations and facilities list. So you can see what's attached there. There are buses and things of that nature. Let's see. It says the Department of Plant Services and the Department of Transportation request approval to declare the Muscogee County School District maintenance and bus shop inventory as surplus, okay? These items have no inventory turnover and are identified as dead stock for the past few annual inventories. The Department of Plant Services and the Department of Transportation are also requesting to dispose of these inventory items through the bid process, public auction, online auction, a donation to public entities, or they would like the right to sell them to another government agency. Any questions? There are 3 attachments, board members, so you can look over the list there. Any questions about that? Hearing none, Madam Chair, I'll turn it back over to you. That concludes the Property Committee.
Thank you, ma'am. Audit Committee? I'm sorry. Policy Committee. One item to appoint the Audit Committee policy. Who is it? Ms. Tillery? Okay.
As the chairman of the audit committee, I was just going to speak to this quickly. One, we're recommending approval for board members. We are looking for another board member to serve. Dr. Sly has done it for a few years and and we thank him for that, but he has said he does not, how do I put that? Anyway, he's not doing it again this year. So if anyone is interested, please let me know. We will say there's 4 meetings. The dates are on here, so if people would kind of look ahead. Or you sent out the dates in an email? Are they on? Okay. Just to make sure, because we do need whoever joins to be there. So that'd be good. But if you're interested, let me know.
So, Lori, as I've told you in the past, I'm interested in finance, but I'm also interested in serving on the audit committee.
Okay.
So I would love to do that unless someone else is just dying to be a part of the audit committee.
Yeah,
Yes, if you would
All right.
add me, that would be good. Yes, we will.
Problem solved, and you do have those dates, right? Yes. Yes. Okay, thank you.
Very exciting meeting.
All right, next is Personnel Committee, Ms. Jackson.
7.01, and that is the personnel report. There's two attachments, hiring for January and the retirement and resignation. Do anybody have any questions?
I do. Dr. Lewis, where are we on staffing? Anecdotally, maybe not even necessarily from Muscogee County, but from other districts, I'm hearing an awful lot about teachers burning out through the COVID, trying to get out. I mean, I have family members who are teachers who are looking for exit ramps. Where are we?
So, just like you mentioned, other districts, we're experiencing some of the same thing. Matter of fact, we sent some of our folks down to a national summit because it has become such a problem with recruitment and retention of personnel, whether it's teachers or others, that there was actually a national summit on in Orlando that we actually sent, and you'll hear more about that in our upcoming retreat about a retention and recruitment plans and strategies we're going to try to bring to you all as part of a plan, comprehensive plan. But it is a struggle. We are losing teachers, we're losing paraprofessionals, bus drivers. It's pretty much endemic across the entire country. It's tough, primarily, and there are a myriad of reasons. For some, it's their own personal psychological issues or health issues. For some, it's they've experienced some behaviors of students that has been challenging for them that they were not necessarily prepared or trained for, or not to that extent anyway. So there are a myriad of reasons, and we're going to be very creative and start really thinking, and not start, but continue thinking outside the box, and that's why we're going to ask you to be very open to that on Saturday morning, thinking about different ways to attract and recruit, because as I've shared with you over the past several years, this is not new, it's just been exacerbated by the pandemic. We have right now a natural vacuum created by the fact that we're seeing the largest number of teachers retire because the large generation of baby boomers are retiring. But also for the last decade, we've seen less people going into the colleges of education than we've ever seen before. So fewer going in the pipeline, more coming out the end of the pipeline for retirement. So we have a natural vacuum, and like I said, that's before the pandemic ever hit. And it's particularly wreaking havoc in a lot of our more challenged schools. And we're seeing that too. So we're going to have to start thinking differently from an equity standpoint. What does that really look like? What does that mean? And equity does not necessarily mean equal. It might mean that we have to do some things differently in terms of pay and incentives to help ensure that our more challenging staffing schools is one of the areas, but also just in general. I can tell you from a personal standpoint, when I was a principal, if I needed an English 1 teacher, when I was a high school principal, I had 50 applications on file at any given time. Now you don't have that. You're lucky if you have a few.
I don't want to, I don't want to have you repeat yourself. So you mentioned Saturday's retreat. Will you have a comprehensive report that will show numbers
Yes,
of where
we can.
we're deficient? And teachers, of course, are incredibly critical to our mission, but so are bus drivers. And I know transportation is going through, some real difficult times.
Culinary.
So you'll have a comprehensive report on
We can give you, we'll try and have you as most updated as we can have at that point in time.
Thank you, I'll wait
Sure.
till then.
And where are we on bringing up someone for transportation, getting a recommendation for Director of Transportation?
We're actually in the interview process now.
Okay.
Dr. Lewis, I would like to add another, just item for Saturday's meeting. Where are we on our program with CSU? I know we approved a partnership with CSU where the students coming out of CSU would be hired by Muscogee County. Are we
Guaranteed a
still
contract.
doing that and it's active? And are we getting a lot of students? I see HR saying yes, so we're getting a good number of students from that program?
Oh, not
Or
enough.
teachers. Yes or no?
Can you hear me? We are getting a number of students from the CSU pipeline. However, and we appreciate that pipeline. However, we do recognize that we need to expand the institution of higher education partnerships in order to be able to sustain the vacancy numbers, not only for our College of Education partnerships, but other fields like nursing, social work, counselors, speech language pathologists, et cetera. So we're looking into, and it'll be shared in the presentation for Saturday, how to expand on those partnerships throughout the nation. There are some amazing enrollment numbers coming out of Ohio State University and Michigan State University that we would like to tap into, because there are opportunities there to bring on different type of the high need functionality for our teacher support. But we are going to be providing that information in that presentation as well.
Okay, excellent. I can't wait to hear it Saturday. Appreciate that.
And I do want to keep in mind too, when we start talking about numbers too, remember, you all gave us the authority to move forward with hiring as many teachers as we could to help with tutoring efforts as a result of the unfulfilled learning opportunities we had during the COVID situation. So some of those numbers are going to be reflected. So they'll look higher than they normally would be if we were in a regular year, because we're trying to get more tutoring and more of those things, and it's all incorporated in those numbers. So it's not going to be as pure as looking at just, okay, this number of classrooms, because it might be tutors, it might be part-time, it might be full-time, whatever we can get. One good thing we are looking at is the legislation that came out of this board, actually, along with some other boards across the state, is proposing for the ability to rehire teachers after they've sat out for a year, after 30 years of creditable service, bringing them back without jeopardizing their retirement. So those are some of the creative ways that George is trying to address some of these things. But that was one of the things that came out of our discussion over the last 2 or 3 years from our discussion with our delegation.
Are there any more questions? Hearing none, back to you, Madam Chair.
Thank you, ma'am. Construction Committee, Mr. Cantrell.
All right. Thank you, Madam Chair. Approve the amendment budget for the South Columbus Public Library renovation project. With the continued rising of construction, the projected new budget for the project has increased from $5.3 million to $6.4 million, a difference of $1.1 million. The library respectfully requests the board to approve the expenditure of the additional of $1.1 million. Now, this started off in June 21st of 21, where we approved $4.379 million, and then in September it had another increase to $5.3 million. So we're looking for a total now of $6.4 million. Is there and this is a question, is there a cap where these things stop? And I know the construction is going up tremendously and it continues to rise, but is there a cap where the money, I mean, where do we continue to have the money for these big increases like we have? I mean, this is now another 1.1 million in 6 months.
Lost item.
Okay.
Yeah, you have to fulfill.
Okay, that's what I'm asking.
Yeah, as you all know, typically what we do with our SPLOST, we have tiered our projects, and we try and take those projects. Inflation has hit significantly in many areas, as most of you know, and certainly those of you who deal with construction know that's not slowing down anytime soon. We think it might, maybe with the inflation coming up, it might slow things down a little bit. But all that said, it's not changing the pricing of anything going down, it's all going up. So there may be some projects we have to reassess redesign and bring back to you, and that all takes time and slows things down. But we're gonna do it to the best of our ability to make sure that it meets the needs of our students first and foremost, but number two, that it works within the parameters that we've set as far as our budget. And again, we may have to revisit some of those budgets and redesign projects going forward to accommodate that. Looking at an elementary school, something as big as an elementary school, that's one, for example, that we're gonna have to really revisit. When we start looking at the renovation to be done at Arnold, that too is gonna have impact. And as you all know, just to put that out there, I think almost every one of our SPLOS, we've always had at least one project that's continued over from
Yes, sir.
the previous SPLOS. We've always completed it, but sometime there's a drag on that we have to carry it over from one SPLOS, hopefully to the next one to complete the project.
Kathy, you have a question?
Yes, I do.
Yes,
Alan,
ma'am.
as you're coming up, I'll address my question. I don't know how much of a question it is, more of a statement. You have your own board, you have your own committee structure and design team and everything. I had some interesting comments on the design when it came out in the Ledger, and the fact that the new wing is so dramatically different in the architecture to what it is being added on to, and whether that was a thoughtful process on the part of your board. Thank you.
It was indeed.
I had to ask.
Thank you. The current building looks like a dentist's office from the street. We want it to be noticeable and bold for South Columbus. I would like to add also that $2 million from this project is coming from a state grant, $1 million from our private foundation. So we're going to continue to find other sources of income for this, but this additional money that we're asking for hedges our bets with our own reserves. So thank you all.
That's the point I was making.
I wanted to say, and I've said this before, and I'm going to say it every opportunity I get. This board, and I know your board is exactly the same because I've served on it, but this board is so very proud of our library system, your leadership, your board's leadership, and the kudos that we hear from our peers from around this state. And I'm going to continue to say it.
We really appreciate that. Thank you so much. We want a building that South Columbus can be proud of.
That's right. Thank you, sir.
Yeah.
And this, go ahead.
Sorry.
Before you leave.
Yes, ma'am.
Could you repeat that one more time? Because we started the conversation and we talked about money coming from the SPLOSH fund.
So $600,000 is from the eSPLOS from 2015.
Right, but the $1.1 million increase is actually coming from your library reserve.
So right now, in the absence of other approvals, I'm going to bank that's going to come from our reserves. But our foundation has agreed to pay about half of that. So we're gonna split that up. But I have to make sure with all of the approval process, the way it goes, that I've got that in line so that we don't have to worry about it. And it's the soonest we can get that contract signed, then the price should not go up.
Right.
Thank y'all.
We need to sign it fast, it sounds like. And this just wasn't a question on the library. This is on all constructions that's going up as far as that. So it's just each one of them is a major jump, as far as on all of it here. And any more questions on 801?
And I also want to point out, in addition to the cost of things going up, I am waiting before I retire or die, whichever comes first, to find a piece of soil that doesn't have some extensive remediation that needs to be done to it. It's just like a treasure trove of nightmares that you pull back and find more problems with our soil, whether it's rock or something else that has been ongoing issues with our soil around here. When we try and build something, it's not easy. Anyway, those are just some things that sometimes you can't see. You can do all kinds of topologicals and geologicals, but until you get all that done, even then, sometimes you find yourself dealing with some issues that you deal with that cost money.
Yes, sir.
Because I don't want another old Spencer where we have something
Sinking,
sinking or slipping or whatever else. So, yeah.
Thank you, sir. Moving on to 802, amended budget for middle school athletic renovations. Approve the amended budget for Phase 1 middle school athletic field renovation. At this point, it's $1.442 million. It's coming out of the E-SPLOS 2020 athletic improvements. And this is for the renovations of athletic fields for Baker, East Columbus, Rothschild, has been labeled as Phase 1. Any questions, ladies? Gentlemen? Yes, ma'am.
Just with all that said, since it is phase one and we're already seeing about a 50% increase, kind of lay out the phases for me and then just a little, I know nobody can guarantee anything, but the ones that are in the end phase will still get the same things as the phase one.
We have it budgeted for every middle school will have the new set of bleachers, same standard bleacher at every middle school that has a playing field, and every middle school will have a new scoreboard that currently has a scoreboard, or they'll have a scoreboard if they have a field. A scoreboard, yes, ma'am. So right now, we don't have a scoreboard on every field. Every field will have a scoreboard. Every field will have bleachers. That way, and the third thing that we're trying to make sure of is the ADA accountability for us to have to get people to the bleachers. So from the parking lot to the bleachers, that's something we have to fix at several schools. After that, each school is literally different. So for instance, just in phase one, what we're doing at East Columbus with the amount of dirt we have to move is completely different than what we're doing at Rothschild with the 300-foot ADA sidewalk we have to put in. So every project's going to be different, but those are the three things that are going to be guaranteed at every project. We've budgeted 4 of those. We've actually gone back and put in more money in those budgets for 4 of those things, counting inflation coming up, and then the other things, fixing the irrigation or putting a new fence up here for them or something like that. That might get removed from the project as we go forward, but the basis will be there for all our middle schools that have playing fields.
I just want to have a point of clarity. It will be deferred, because whatever we promise on the SPLOS, of course, we delivers. And so we just want to.
They will be delivered.
Yes, sir.
Every school will have
a different circumstances.
Yeah, but every school will get a new scoreboard.
Will meet those 3 things that the standards that you identified.
Yes.
Particularly that we will be ADA compliance. But I just want to make sure that the public know, because we thank them and we appreciate them for their continued support on the E-SPLOS and what it has allowed us to do and how we serve the whole child in Muscogee County. Whatever was on the referendum is what we're going to deliver. And I'm just saying that not because you said anything, but I just wanted to make this point
Absolutely.
of clarity to ensure that whatever is on the referendum, we have to do. And thank you for pointing out so that we will know that it's going to look different because of the topography and the layout of every school, that it's going to look different. That's, now that you said that, is common sense to me. But I'm glad that you said it out loud so that we will know that things are looking different because we had to, based on, the design of the facility, design of the school to do it differently.
Our main goal is to standardize the accessories.
Right.
The seating, the scoreboard,
Right.
so that we are the same at every school. So no matter what middle school football game, soccer game you go to, you sit in the same bleachers, you look at the same scoreboard. That is going to be standardized. Everything else, like you said, it depends on the school.
And beyond that, I think it's important to note too, that I want to just acknowledge Coach Battles, all the coaching staffs that are in high schools, as well as plant services, because they're also maintaining the fields. That's something that a lot of times gets left by the wayside or not thought about, but they are doing a great job of maintaining. You remember all the athletic fields we did for the high schools as a result of the last E-SPLOS? Not only were they built, but they're being maintained and as well, whether it's the playing surface, the bleachers, whatever it is. And that's really important to me to make sure that we maintain those facilities so they don't get down to the point where they're run down like before. And so they're going to be maintained. And that's something they're doing on a regular basis. And I want to make sure that they get acknowledged for that and thank them for that. Because the coaches do this. Coach Battles does it, and our plant services are always continuously trying to make sure they maintain those fields, and that's important as well.
Thank you, Jeff. Any more questions on 802? If not, we'll move to 8.03, contractor athletic field renovations. You might want to stay around, Jeff, in case there's a question. Contingent upon approval of the revised budget for Phase 1 middle school athletic field renovations, approved construction contractor of Freeman and Associates. Is this the same one, or is this?
This is for the contractor.
Okay. It's a budget impact of $1.3.2 million. The construction budget will come out of the overall project budget of $1.442 million. Any questions on this, ladies and gentlemen? If not, we move to 8.04, delivery method selected. Approved construction manager at risk and guaranteed maximum, price budget not to exceed $400,000 renovation projects at Brewer, J.D. Davis, Key, Lonnie Jackson, Rothschild, and Winton Arts. Remains under $400,000 each. It'd be a budgetary impact of $2.4 million for all the schools. Question, yes, ma'am.
David, or somebody. Before we go down this road, I'd just like somebody to make sure that they qualify what guaranteed maximum price is. So everybody hears it at the same time, and we don't have everything getting questioned when the price goes up a little bit.
Board Odom, Director of Plant Service Center and Director of Construction. The GMP, or the guaranteed maximum price for the project, is the amount of the construction, the cost for the project. It's what's under, when it's a construction manager, is their price to not exceed for the construction of that particular project.
But it can exceed it if unforeseen circumstances enter into the process.
That is correct. But
such as increasing construction prices, bad dirt, et cetera. So it's not a guarantee.
No, it's not a guarantee.
It is a really good ballpark.
That's correct, but we would return for
Make sure
approval.
everybody hears
Yes.
that. Okay, thank you.
Good job. Thank you, Ward. Yes, ma'am. Ms. Chambers?
The district, the 5-year local facilities plan, this is a part of that. What year are we in, and when is it time for us to renew that facilities plan?
So the renewal of the 5-year.
Wait for it to go red, Ward. There you go.
Go ahead.
Okay. The renewal of the 5-year facility plan will be in 2023 when we have to update our 5-year facility plan. Of course, we update it continuously and annually, but the overall update will be in 23.
Any more questions on that? That's sort of the reason why I had that first question with the library, because I pre-read all the increases on all of them, so people would know it just wasn't a library project. It's all of them, as you can see right here. The next one is 805, the Shaw Freezer Project. Let's see if this is, the interior cooler freezer at Shaw High School have surpassed their life expectancy, are in need of replacement. School nutrition and the construction department made applications during the FY19 application window for the Georgia Department of Education to replace the cooler and freezer at Shaw, and it had come out of the 2015-2020 East Plus, but I don't see a price on it, so. So that's as far as I can go on there, unless somebody wants to add to it.
Gotta be done.
Okay. Move down. Yes, sir.
Okay, this is,
Yes, sir. Green is for stop, red is for go. Madam Chair.
Thank you. This is for the approval of the architect for the design and budgeting of it. So once that is designed and budgeted, then we'll return with a budget amount for this project.
Just for the architect.
It's for the architect, to approval for the architect to start the process.
Before next week, you'll have that price, or?
No.
No, that'll be later.
Might want to stay around, Ward. 806, construction status report. Do we have a video slide to be presented?
You miss your PowerPoints, don't you, Mark?
If not, that's okay, but it's,
They were nice.
yes.
They were pretty.
Ladies and gentlemen, you can look over all of them and see if you have a question on any of them. You can see we have a lot of construction going on in the community with our schools. Any questions on any of them?
Busy, busy.
Yep, lots of stuff. If no questions at this time, yes, ma'am. Kia?
On the HVACs that are listed for Hannon and a couple of other schools, didn't we remove that last month? The HVAC system from the application? And we were gonna add it again? I maybe,
At Hannon and Kendrick, where the status report is, those were not removed. Those were the 2018 that were able to be completed. It was some other schools, they're not fresh in my memory right this minute what they were, but we did remove some schools, and we'll be reapplying. But those two right there are in the process, almost completed, actually. Yes.
Thank you, ma'am. Any more questions? Madam Chair, that's all for the Construction Committee, ma'am.
Thank you, sir. Finance Committee, Ms. Williams.
Thank you. Madam Chair, Finance Committee has normal reports, but 9.01 is your budget calendar for FY 2023. Board members, please look at this because our budget process is about 6 or 7 months of pretty intense work on a number of our cabinet members and the administration. There are different opportunities for you to weigh in. You'll start seeing numbers, I believe, in March. Is that right, about March? Come back in June for final adoption, and July, kind of finish it up to start the new year. In March, we do the parameters. Isn't that what it is? Okay, yeah, in March, this is when the board will be asked to develop the parameters. We'll start that discussion on Saturday. So just remember, it's a long process. I know that sometimes we start it and then we kind of forget about it because the staff is working so hard behind the scenes, and then it comes back and we're like, oh yeah. So just pay attention to that because it is important for you to see and acknowledge what our staff does. Are there any questions on that calendar? Seeing none, that takes us to 9.02. This is your purchase exceptions, A and B, bids and quotations. You've got, I think there's 3. It's Frog Street, Vista, and Sabbas Esser. Quotes before you with recommendations for approval for next week. Any questions on any of those 3? Seeing none, that moves us to 9.03, purchase exception C. This is for our maintenance. You have one vendor, Bibliotheca. Say that 10 times fast. For a renewal, is there any questions on that item? Bibliotheca.
Sorry, I have a question.
Go ahead, Ms.
Apparently, I'm supposed to be working the mic,
Go ahead.
I did it. And this is backtracking a little bit, but some of this, like the adoption and stuff, is some of that coming out of our federal fund? Yes, okay. Thank you. That's what I figured, but I just think that's also good to point out because these are kind of outside of our normal budget cycle that normally we would not do if it was we would try to avoid, so that pointing out that that's why this is outside of our normal budget cycle.
Thank you, Ms. McRae. That takes us 9.04, purchase exception D, renewals. I'll have to say this one was new on me. And I've served on this board for I think, I don't know, a long time. And this is the first time I've seen that we have to pay tens of thousands of dollars every year based on how many school buses we have on the road in highway impact fees. You know, sometimes people don't realize all that we do have to pay, but this is for our annual Department of Revenue highway impact fee of I think it's about $59,000. Any questions on that? At least we have new buses that are impacting our highways now. Thank you to our East Blast and all of the voters of Muscogee County. That takes us to 9.05, purchase accept. Go ahead, Ms. Buckner.
Just trying to, I was noting also, yeah, you're right about that, Dr. Lewis, we've been paying this annually, right?
Apparently.
Okay, so you kind of, called it to our attention this time. Is it more than it usually is, or?
No, about the same.
It's about the same, but you're just starting to call it to our attention. Okay.
Call it what it is.
Huh? Oh, okay, I'm just,
Oh,
is there
I'm sorry.
anything else?
Transparent, not extortion.
Is there any other thing is there any other thing that we're paying that we don't know about?
Hopefully not. We're just being a little more transparent to make sure the public understands everything that we pay.
Okay.
And various fees and
Thank you.
requests. That takes us to 9.05, purchase exception E for additional purchases. This is under bids and quotations. 2 items, Love Like Lexi and Scholastic Learning Materials. Are there any questions, board members? I will ask Dr. Lewis, I know there was a couple of questions from some parents on Love Like Lexi. Was that able to get together with those, I think it was maybe 1 or 2 parents to help
Yes.
them understand that program?
Dr. Nelson is working through the process with them.
Good.
But yes.
Good, thank you, I appreciate it.
I'm not sure if we met their satisfaction, but we did
Well, I
go
know
through the process. Yeah.
That's, you know, that's not the
Right,
answer.
yes, ma'am.
I just want to make sure
Yes,
that
ma'am.
we're engaged in the conversation.
Dr. Nelson was very efficient along with her staff to work through meeting with them. Yes.
Thank you very much. Any other questions? That takes us to 9.06, purchase exception G. These are your professional services. You have 2 item areas. One is proximity learning and the other is the soccer's officials. Any other questions on those? Nope. 9.07 is the competitively bid purchases. You have 1 item for school band uniforms for Shaw High School. Just remind board members that our band uniforms are on a cycle that they each get certain band uniforms every so often, whatever it is, whatever that cycle is. Takes us to 9.
1 minute,
Go
Ms.
ahead,
Williams.
Ms. Buckner.
Now, on that cycle, the district gives 25,000, right? Okay, so each school, the school district does not purchase the entire. We contribute. The district contributes 25,000, and the schools have to raise the rest of it.
Good point. Good point. Thank you, Ms. Buckner. And that takes us to 9.08. This is your monthly purchase order increases. There are 2 areas. One is the ENA and one is Woodall GNETs. Are there any questions on those 2 items? Hearing none, that takes us to, wait a minute, I've lost my place now. Yep. Okay. That takes us 9.09, sole source and volatile purchases. This is automated logic equipment and your monthly fuel and Snap-on tools. Any questions? Keep losing my place. That takes us to the next 4, which are your normal monthly reports. 9.10 is your new budgets, 9.11 is budget adjustments, and 9.13 is your financial statements. Are there any questions on any of those? And then 9.12, I'll just bring your attention to this month's donations. Account for almost $30,000 from individuals, corporations, PTAs, civic groups and alumni and just everybody who cares about public education system in Muscogee County. And we appreciate it. It's from dozens of different entries. I encourage you to see that on our website. There will be PowerPoint that is posted every month. And Madam Chair, that concludes my report. Oh, I do have a question though. Did you tell before I got here? Okay, thank you.
I just have a question about under 9.10, the new budgets under the Mill District grants. I know we did an MOU not long ago with the Mill District. I thought they were going to be providing like a principal, things of that nature. I noticed in the budget, there's some teachers also included in that. And I'm just for a point of clarity, they are actually giving us $285,000 to cover these teachers. Are they additional teachers, or is that allowing us to save $285,000 from our budget?
Those are additional positions that are not typically in other schools, or they're in addition. Specialized, yeah. So that school wouldn't normally get an assistant principal. This allows them to have that assistant principal.
This is the MOU, just to give a little more clarification, is with the Mill District. And the Mill District and Fox Elementary is a purpose-built community.
Right.
And this is really one of the requirements to become a purpose-built community designated school that Fox is that these positions are there. And so the Mill District raises the money for those positions, since we don't.
Those additional.
Yeah.
And you know, it's just an amazing partnership.
It's like a wraparound services
Yeah.
addition pieces for, yeah.
Thank you.
I'd like to hear more about, not here in this medium, but what additional services are those kids at Fox receiving because of our partnership with them? Maybe Saturday or some other time?
Not this Saturday.
I'm
I've
sure.
got this Saturday booked. If you want to be out by noon.
Thank you, Ms. Chambers. That concludes my report.
Ms. Williams, I have one comment, please. You should have in front of you the final draft of the financial statements and the final draft of the letter from the auditors, just to let you know that it is final and that there were no changes from the December report. So just letting you know that you have that information. Thank you.
Thank you very much. You want to say something? What about you?
I want to just close that when you're ready.
Okay, I do want to say, today is Valentine's. We didn't have our record sprint meeting. I guess we don't have Valentine's at home. I don't know why we didn't rush out of here.
These are. Yeah, so on behalf of the cabinet and myself, we wanted you to all have these. Thank you for spending your evening with us. Yeah.
Thank you, and also, you know, you've been seeing my futures all over the place. I want to say thank you for our gift from CTAE, Ms. Victoria Thomas. Thank you so very much for all that you do.
Absolutely.
And yeah, she's been here waiting patiently. Just didn't want to overlook that and the activities that's going on this week.
Yep.
In support of that. So you can, it's on the website. I know I saw that. I think I saw it in the email.
Yeah, this
as well.
whole week is focusing on careers and career pathways from elementary through high school in our district, Monday through Thursday, I believe it is this week. And again, just want to thank CTAE, headed up by Victoria Thomas and her team. But this is something you should be seeing and hearing about, and encourage parents to talk to your kids about what activities are being done in the schools this week, talking about their futures. Go ahead.
Come
to the light.
Now, as you come, Mrs. Thomas, is this what we what we traditionally do as the Career Education Week? old time school, old school?
Oh, no, this is something different. I was just saying, I didn't want to leave out, the Department of School Counseling. I hope I'm saying.
Absolutely.
This is from that very detailed presentation that we had
A few months ago.
a couple of months ago, where they were talking about they were gonna partnership and really have kids engaged in determining their career paths.
Well, since you brought me up here, I just wanted to say that, that it has been a partnership, and we work with, the Department of, maybe, I don't want to say it correctly, School Counseling. So it's been, an effort between, Division of Teaching and Learning and Division of Student Services. So we're really excited, to have students, thinking about the future, because the future is always positive. And so we hope that if you have an opportunity to visit some of our schools, you should see, yard signs and, banners as well, posters around the school, pre-K through 12.
And in your folders there, you also will receive a link, because I know sometimes it's easier to have on your phone, but there's a calendar of events for each school that the school counselor is initiating. So please join us, jump in.
Would you send that to
The
would you
celebration.
send that in an email, please?
Yes.
To all of
yes,
us, thank you.
we
Or to
will.
Ms. Jones?
Yes, yes,
Thank
yes, ma'am. So we are really excited for our kiddos from, like she said, pre-K all the way up to seniors. And Friday is a staff development day, but we're asking our teachers, so there's activities also for our teachers on that Friday. So we're having seminars on forgiveness, for your loans, all kinds of different activities happening that Friday for our teachers, too. Georgetown Elementary, Friday.
Thank you.
Thank you. And just a few other things. There's a lot going on, has been a lot going on, always is a lot going on, but I just want to highlight, also tomorrow at Marshall Success Center, they have Georgia Public Broadcasting, and they're doing a civil rights movement presentation that's going to be ongoing there. And then Let's Grow STEAM with the Youth Career Expo is also being conducted February 16th and 17th. So a lot going on with STEAM activities there. As already mentioned, we have Staff Development Day on Friday and President's Day on Monday, so no school. And then just a reminder, we do have our board retreat on Saturday from 8 till noon.
8:30.
Well, 8:30 is your, we're starting at 8.
Those
We're starting
30
at
minutes
8:30.
matter.
Starting at 8:30. So we'll have something about that. Anyway. And then also just a reminder too, that this past couple weeks, we've been able to host all-district elementary music showcase. We've had band, chorus, and orchestra. We've had students from all over the district here performing. Really outstanding quality items for that. And then in athletics, we're going into our regional basketball tournament starting next Tuesday. But on top of that, we had 2 state champions in wrestling this past weekend. I'm going to try and we'll recognize a lot of these kids coming forward as we do every month going forward. But particularly congratulations in 4A and the 113-pound class, Tyler Wynn from Columbus High School. Also in the 4A 170-pound class, Tyler Secoy, I think that's how you pronounce that, also from Columbus High School. And several other state runners-up and 3rd place and 4th place, but we'll be announcing those in general. But congratulations to those 2 new state champions in wrestling. So, very good. So sports, music, arts, we've got it all going on. And again, with our great partnership with the museum and the library system, we're very fortunate and very blessed. That's my report.
Happy Valentine's Day.
Yeah, really.
Yeah, happy Valentine's Day. Have a good evening. Thank you all. We are adjourned. See you next Tuesday.